Hey guys, it's Dr. Childs here. Today we're going to be talking about the thyroid medication called Tirosint, and specifically we're going to be talking about Tirosint versus levothyroxine, but also compare it to the other thyroid medications that exist out there. And I'm going to try to make the case for why you might want to consider switching medications from what generally like levothyroxine or Synthroid over to Tirosint. Okay. So let's kind of jump right in here. If you didn't already know, Tirosint is a T4 only thyroid medication, all right? And that's important because T4 only medications, the other medications in this category include levothyroxine, Synthroid, Levoxyl, etc. And these are generally the medications that most doctors prescribe. The fact that they're T4 only is very important because T4, in order to be activated in the body, has to be converted to T3, right? So by taking a T4 only medication, you're kind of operating under the assumption that there is complete conversion happening in the body. And that turns out to not be accurate in many cases, especially in settings of inflammation and chronic illness, etc. And by the way, this might be part of the reason why many patients don't do well on levothyroxine and Synthroid, right? This might be the fact that you may give them the T4, which is inactive, but they don't actually convert it to T3, which is the active thyroid hormone. So Tirosint falls into this category of T4 only, but it's different than the other T4 medications because it's a little bit quote unquote cleaner in terms of the inactive ingredients included with the active ingredient. Okay, so I'm going to explain that a little bit more because that concept might be a little bit nebulous to you. But let's just compare levothyroxine and let's compare Tirosint. So levothyroxine and Tirosint both have the active ingredient, which is T4 thyroid hormone. Okay, so they both have that, and if you get 50 micrograms of levothyroxine or 50 micrograms of Tirosint, you're getting the same amount of T4 in both of these formulations, right? So where they differ in is the amount of inactive ingredients. And I'm going to show you a chart and show you exactly what's in levothyroxine and exactly what's in Tirosint. But the point is that these inactive ingredients may explain why certain patients do much better on Tirosint versus levothyroxine. Okay, and that might sound a little bit confusing right now, but we'll talk about it exactly why that happens. So Tirosint has one active ingredient and three inactive ingredients. And as far as medications go, that's pretty darn clean. In fact, most medications have a slew of inactive things added to them. So you can see here that Tirosint contains the levothyroxine, which is the T4 component, which is the active thyroid hormone. Then the three inactive ingredients include gelatin, glycerin, and water. So those are inactive, and those are pretty benign, all things considered. Now let's just compare that to levothyroxine. So levothyroxine has levothyroxine in it, which is the T4 thyroid component, which is the active ingredient. But then take a look at all these inactive ingredients. So butylated hydroxyanisole, silicon dioxide, magnesium stearate, mannitol cellulose, povidone, sodium lauryl sulfate, sucrose, and then a whole bunch of color additives, which depends on the size and the dosing. So if you're getting a pink levothyroxine pill versus a purple levothyroxine pill, there are different fillers and dyes that are included in there to make it that color, right? Something has to be added. And so this is where things get really interesting. Part of the problem well, let me talk about this first and we'll jump into there. So I'm going to mention real quick here, and I've included the graph here, which is actually pretty interesting. It includes, in addition to all of those inactive ingredients we mentioned with levothyroxine, this is the colors and dyes that are added to each of the various strengths of levothyroxine. So you can see the 25 microgram strength has FD&C yellow, number 6, aluminum lake, whatever that is. Obviously, it sounds a little odd. But when you get to the 50 microgram dose, it actually doesn't have any additional fillers or dyes. So if you're on levothyroxine and you can't switch to Tirosint for whatever reason, and we'll talk about potential obstacles that may occur, you might want to consider just switching your dose to some variable of 50 micrograms. So for instance, let's say you're on 125 micrograms of levothyroxine and you're taking the 125 microgram tablet right here, which includes FD&C blue number 1, aluminum lake, FD&C red number 4, aluminum lake, FD&C yellow number 6, blah, blah, blah. So let's say you're on that one pill. Well, what you can do is you can actually switch to 50 micrograms and take 2.5 of the 50 microgram tablets, which doesn't include any of these other fillers, and get to the same dose. So if Tirosint is not an option, that may be something worth considering for you. Okay, so let's talk about why this would even matter. Why does it matter that there's so few inactive ingredients in Tirosint? How does this impact, why you may want to consider, and how does this change things in your body? So if you're considering so I want to go over the patients that should consider doing this, and so it's worth spending a little bit of time, because let me just paint the picture of what's happening from a pathophysiologic standpoint in the hypothyroidism kind of body here. So thyroid hormone's involved in the production of stomach acid. We know that. But what you may not realize is low thyroid hormone leads to low stomach acid, and then low stomach acid is required for the absorption of many nutrients, including iron and vitamin B12. It's required for the proper breakdown of food, the assimilation of micronutrients, etc. So if you have a situation where you're having low thyroid hormone, okay, well, hypothyroidism from whatever cause, could be Hashimoto's, autoimmune thyroiditis, could be nutrient deficiency, whatever. You have low thyroid hormone in your body, you are going to have low stomach acid, right? But what makes it difficult is if we give you then a medication to try and replace your low thyroid hormone, but we're giving you a medication that has all these inactive ingredients and fillers, your body is still required to break down that medication for complete absorption. But if you're having a hard time breaking down the food, it's not inconceivable to imagine that it's going to be difficult for you to break down that medication, right? So it's just kind of a little bit of intuition and common sense here. But so if I give you 50 and this is an gross exaggeration, but it can kind of help you understand and drive this point home. So let's say I give you 50 micrograms of levothyroxine, and your body, because of the low stomach acid, is only able to break down and absorb half of that dose, right? So you're only going to get half of the dose you think you're getting, right? Compare that to Tirosint. So if I gave you 50 micrograms of Tirosint, it's not hard for your body to break it down because there's so few inactive ingredients in there. So you're able to assimilate that. Your stomach acid, even though it's a little bit less, is able to break down that the capsule and the other byproducts, and it allows for rapid absorption, especially since it's kind of in a liquid base. So that's one of the reasons that many patients will report this dramatic improvement when they switch from levothyroxine over to Tirosint or Synthroid over to Tirosint. And I don't think it's because it's a magical medication. I think it's just because your body's actually absorbing the thyroid hormone that it really needs. Okay, so let's kind of put that in mind and explain then who should consider using it now that we kind of have that in the back of our head. So first of all, any patient with gastrointestinal issues, okay, which includes but is not limited to any of the following GI-related symptoms. So if you have a known diagnosis of these things, then you might not be absorbing for the reasons I mentioned previously. So this includes low stomach acid, right? So that includes every patient with hypothyroidism that isn't being treated. Acid reflux, so that could be GERD would be another name. And I should point out here too that anybody taking acid blockers falls into this group too, because acid blockers by definition reduces the amount of acid in your stomach, right? That's what it's supposed to do, which influences your digestion further. If you have a known diagnosis of small intestinal bacterial overgrowth, which is which is SIBO right here, or small intestinal fungal overgrowth, SIFO. So SIBO and SIFO tend to go together, but and they're very common. They have about a prevalence of about 50% or so among hypothyroid patients. So there's basically a coin flip chance that you have SIBO and or SIFO. The next thing on the list is irritable bowel syndrome, so you know if you have that. Generally, you know if you have that. Doctors are usually pretty good at diagnosing that. Inflammatory bowel disease, that's what IBD stands for. And then any GI-related surgery that alters your anatomy in the GI tract. So that could be like gastric bypass or Roux-en-Y surgery, some sort of gastric banding, whatever it is, anything that anatomically changes your intestinal tract, generally in the vicinity of the stomach and the small intestines. It gets less important if you're in the colonic area, but upper GI-related surgeries that change your anatomy, you would be included in this group here. Okay, and that's obvious, right? Any of these GI symptoms will alter the absorption. It'll change the amount of stomach acid that's available. It'll alter all of those things that we just mentioned. Another group of patients who should consider this is patients who just know they don't tolerate Synthroid, levothyroxine, or Levoxyl, right? Or patients who have taken these things but have experienced negative reactions to them, which is probably from the inactive ingredients, as we mentioned before. The third category would be patients with multiple food allergies or sensitivities. So this, again, is very common sense. The more sensitivities that you have, or the more hypersensitive you are to inactive ingredients, well, you have a higher chance of reacting to the inactive ingredients in levothyroxine because there's just more of them, right? This is just statistics. If you're more sensitive and there's more ingredients, then you're more likely to react, right? So if you fall into that category, and you know who you are if you have multiple food allergies and sensitivities, usually these people know, they have weird reactions to food and to medicines, and they're reacting all the time. They tend to have to start low with medications, etc. Next category would be patients who have increased intestinal permeability. Okay, that is really the name, the real name for what you probably refer to as, or have known as, leaky gut, right? So this is a little bit better way to describe it, because what it means is that the intestinal barrier is not as tight as it should be, which allows larger products to go through, which can stimulate the immune system, and through molecular mimicry and a number of other issues can cause, well, is felt to be at least contributing to autoimmune disease and a number of other issues. But you may know, again, if you have increased intestinal permeability, aka leaky gut. Patients, this is another interesting one. So next category would be patients who don't tolerate NDT medications or are too sensitive to T3 containing medications, right? So if you were switched from, let's say, Synthroid over to Armour Thyroid because you finally convinced your doctor to do that, but you were having crazy heart palpitations, sweating, jitteries, or anxiety, any of those symptoms, then you just may be somebody who may not be ready for T3 medications, or because of other problems and nutrient deficiencies in your body, you're just not quite ready to tolerate that T3. Now, yes, that topic is a little more complex, so I'm not going to dive into it, but generally what will happen is the doctor will, at the insistence of the patient, will finally switch somebody from, let's say, Synthroid 100 mics to Armour Thyroid 60 milligrams, and the patient develops heart palpitations, and they say, "See, I told you this is a bad medication." Well, that's not entirely true, but it's probably easier to just have your doctor then switch you from Armour Thyroid to Tirosint than it is to try and go up on the dose and to titrate that T3 and manage that whole system. But it is possible. It's kind of variable in there in terms of how you react. Okay. Then the last one is patients who have experienced some improvement on levothyroxine or Synthroid, but there's still some more room for improvement. So let me explain what I mean here. So let's say you're diagnosed with hypothyroidism. You start off on levothyroxine, you notice a 25% improvement, you go up, you get another 25% improvement, so you're sitting at maybe a 50% improvement, and then you're kind of stuck there, right? So your energy's up a little bit, maybe you lost a couple pounds of weight, whatever, but you're just not all the way there, and your doctor's like, hey, your labs are fine. So what might be happening is, well, a number of things might be happening, but those patients who fall into that category may benefit from switching over to Tirosint. So we have kind of a pretty broad list, but it all makes sense. It's all intuitive, and it's kind of obvious as to why you might want to switch. Now, there's one other thing I talk about here just to make sure that you get the proper amount of HCl, and you can take some supplements to kind of boost that. I also talk about B12 deficiency, which we kind of already mentioned, so we're not going to touch base on that further at this point. But here's the question I get a lot, and that is, does Tirosint cause more weight loss than levothyroxine or Synthroid? Okay, everybody in the thyroid community is, and rightfully so, is worried about weight in some way, right? They just want to do whatever they can, and I get it. It's very difficult to lose weight if you have hypothyroidism for, again, a number of reasons which we're not going to go into here. But let me attempt to answer this question without getting too nuanced here. So first of all, the answer is it maybe, right? That's always going to be the answer, maybe. But let's say if you were on levothyroxine, you were feeling good, and you made the switch, you're probably not going to be in that category that's going to have a significant amount of weight loss. But if you were taking levothyroxine and you were either reacting negatively to the inactive ingredients, or you simply weren't absorbing it because of the GI-related issues that we mentioned previously, then taking Tirosint may allow for increased absorption of the hormone, which may allow for assimilation and conversion of T4 to T3, and then you might experience the weight loss that you were looking for initially. So there's some ifs there and some maybes there, but you still have let me put it this way, you still have a higher chance of achieving the weight loss on Tirosint versus levothyroxine or Synthroid, simply because of the assimilation, the absorption, and then the lack of risk, I should say, of reacting to inactive ingredients. So probably one of the best ways. Now, if you've paid attention to any of the stuff that I've put out, if you followed my blog or anything like that, then you probably know that I'm a big fan of combining T4 medications with T3 medications. So Tirosint is actually a really good medication to combine with other medications. So when I say, switch to Tirosint, yeah, generally some of you out there may only need T4 if you have no issues with converting, but the reality is many patients do have some issues with converting. T4 to T3 is what I'm referring to when I say conversion. So the good news is that you can simply add Cytomel or liothyronine or sustained release T3 to Tirosint, and you get a pretty robust reaction. So it is safe. Don't worry about that. The next thing is Tirosint dosage versus levothyroxine dosage. If anything, you might actually need less Tirosint compared to levothyroxine simply because of that likely increased absorption. So, but if you're going to transfer straight over, you can usually do that with maybe a little bit of titration, or maybe start at maybe 75% of the dose and kind of go from there. That's really individual. It just kind of depends on the person, their absorption, their history, their GI tract problems, how many other hormone imbalances they have, etc. But generally, you can kind of consider the Tirosint dosage to the levothyroxine dosage. It should go across pretty rapidly. I want to go over a couple other FAQs here, so frequently asked questions I get all the time from patients that may actually help you. So let's kind of do that. Is Tirosint a T4 only thyroid medication? Yes, absolutely. So there are limitations in terms of how effective this might be for you because it is a T4 only medication, T4 only thyroid medication. Now, having said that, it's probably the best of all the T4 only medications, right? So I've included a list here. Medications that contain T4 include levothyroxine, Synthroid, Tirosint, and Levoxyl. There might be other names for this in your country or whatever it is that you're from, but generally these are T4 only, and the active ingredient is going to be levothyroxine. Okay, compare that to medications that contain T3 only, include Cytomel, liothyronine, and then SRT3, which is sustained release T3. And then here we go on, this is the group of medications that contain both T4 and T3. That's usually the natural desiccated thyroid formulations like Armour Thyroid, WP Thyroid, Nature Thyroid. But you can also get formulations from a compounded pharmacy that have T4 and T3 in them in variable dosage. But the point is, yes, Tirosint is a T4 only medication, but I believe that it's probably the best of all of that subcategory of T4 only. Will Tirosint work for me is the next question here. And I don't have a good answer for you. I don't know. In my opinion, it tends to be more tolerated or better tolerated than the other T4 thyroid medications, but also in my experience, most of my patients do need T3 in some form. Very few patients are able to completely take whatever T4 I give them and natively convert that into T3 and not have any issues, okay? But it's worth pointing out that I have kind of a biased sampling of the population as a whole because I'm really only seeing patients that have been to multiple endocrinologists or family practice doctors who have tried multiple different types of medication combinations and such. So I realize I'm probably seeing more of the more difficult or complex cases. So in reality, even though I say only 2% of my patients do well on T4, that may not be true if we extrapolated this out to the entire U.S. population or beyond that even. So just consider that. I do think you have a better chance of having this be more effective for you than, let's say, levothyroxine alone. But don't be surprised if you do get some improvement, but you're not all the way there, because then that might be an indication that you are not converting, and maybe you need some T3 added on to your total dose. Hopefully that's making a little bit of sense there. So the next thing is, can Tirosint cause weight gain? And absolutely it can cause weight gain, right? So, and this kind of blows the mind of a lot of people, and I'm not sure why this is so difficult for people to understand, but yes, the thyroid medications can cause weight gain. And I have an idea as to why that is. I'm not exactly entirely sure, but my suspicion is it's probably due to, again, this conversion issue that we keep bringing up. So it seems like some people, just to kind of give this to you as a general concept, T4 must be converted to T3 in the body in order to be activated. But the thing is T4 has two options. It can convert to reverse T3, which you don't want because that's an anti-thyroid metabolite, or it can convert to T3, which is the active thyroid hormone. So it's kind of like your body has a choice. Now, if you provide your body with substrate, you're just really hoping that the body's taking that T4, that substrate, and turning it into T3. But in certain scenarios and under certain physiologic conditions, your body may say, I'm going to take that T4 and convert it to reverse T3, and then now you're just basically fueling the flame, and making everything worse. So that's probably, or at least in part, why I think some patients can gain weight on T4 only medications. This can actually happen on NDT, but paradoxically, and I really don't have a good answer as to why this can happen, and so I don't write about it a lot because I'm not exactly sure, but T3 only medications can cause weight gain too, which is very interesting to me. And I don't know if that's a combination that has to do with muscle mass or something else, but anyway, so we'll leave that alone for now. But the point is, Tirosint can cause weight gain like other T4 medications. So how do you take it? Like other thyroid medications, take it first thing in the morning. I do have patients that can take it at night. I mean, that's, again, I'm not going to get into that. That's a whole other kind of topic by itself. But you can take it generally away from food. I usually say minimum at least 1 to 2 hours away from food and away from other supplements. Some are worse than others, like calcium and iron. You want to get it as far away, at least 4 hours from those things. But in general, take it by itself and alone, because that will increase the likelihood of complete absorption. Can Tirosint be used with other thyroid medications? Absolutely. I like to combine it with immediate release forms of T3 like Cytomel or lyostethyronine. And then lastly, does Tirosint, actually this isn't lastly, we'll talk about cost lastly, I believe. So does Tirosint have any side effects? And yes, absolutely. So most of the side effects come from two main causes here. So we've got the side effects caused by too much thyroid hormone, okay, and those symptoms mimic hyperthyroidism, and then we have the side effects from inactive ingredients. So in this case, and levothyroxine, a lot of people actually feel like they're getting quote unquote hyperthyroid or whatever it is. That's actually not true. Most people on levothyroxine actually react to the inactive components, and they have very weird headaches, flushing, rashes, things like that, very, very abnormal symptoms that may be confused with hyperthyroid-like symptoms, but it generally is due to these inactive ingredients you're reacting to. So the hyperthyroid-like symptoms you may experience if you have too much medication include heart palpitations, feelings of anxiety or jittery sensation, rapid weight loss, sensation of overheating or feeling like you're warm or feeling like you're flushing, anxiety, depression, or other mood changes, things like that, insomnia, inability to sleep at night, reduced depth and quality of your sleep, or changing your sleeping patterns. Those are all things that may relate to too much thyroid hormone. And if you have those symptoms, you really need to get checked out, rather quickly. Now compare that to the headaches and the flushing and the rashes and the weird gastrointestinal symptoms, maybe some diarrhea or upset stomach or migraines, things like that. That's more related to the inactive ingredients. But as I mentioned, Tirosint has fewer inactive ingredients, so patients tend to get less of those reactions, okay? And then lastly, Tirosint cost. So it's worth talking about this because it's a new medication. Pharmaceutical companies can kind of price it however they want in the beginning until the patent falls off. So in this case, they've decided that the cash price is right around, let's see, $122 depending on location, and you can use GoodRx. I tell you how to kind of do that if you want. And now that's the cash price, assuming you have no insurance or anything like that. Now, luckily, they have some copay issues and some coupons that you can get, I guess, as low as $35 a month by clicking at some of these links that I've given you. But the point is, and the point here is that there are things that you can do, but even if they don't work, it's probably worth at least a 1-month trial of paying a little bit more to see if this can impact your life for the better, right? So, in my opinion, it'd be worth spending $100 a month if that meant that your energy levels improved 50 to 70%. If you lost an extra 10 pounds, if you did all these other things, right, that would probably be worth that increase in cost. On the other hand, if switching is of no benefit to you, then probably not worth staying on it, right? And then if you're anywhere in between there, you're going to have to kind of play that one by ear based off of how you feel, how much improvement you got, if any, and kind of go from there. But yes, Tirosint can be a little more expensive than traditional medications, just to give you to be honest about that. And I have nothing to do with Tirosint, by the way, or the company. I'm just giving you this information here and giving you some resources. So that's kind of the end of this video, guys. So if you have any questions, I'd love to hear them. So let me know if you've been on levothyroxine, if you switched to Tirosint, if that caused or helped reduce your symptoms or had any improvement. Subjectively, I know a lot of patients who have made the switch and have felt a lot better. They get a ton of improvement. But that's just subjectively. There's not a lot of data that shows switching can be superior, and because of the current treatment paradigm, not a lot of endocrinologists and GPs consider the inactive ingredient as something that's limiting the benefit that medication may provide, even though it makes sense intuitively, right? So anyway, hope you guys found this helpful. If you have any questions, please leave them below. I'll do my best to get back to you and answer them as soon as I can. Okay, talk to you guys later.